May is Mental Health Awareness Month. Over the last several weeks, I've been having conversations with coaches, former and current athletes, and mental health professionals about how the landscape has changed in recent years and why mental well-being is just as important as physical. These discussions started with the professionals. I talked to Dr. Timothy Malone, a psychiatrist and the director of athletics mental health at the University of South Carolina, as well as Sarah Knoll, the director for mental health and performance, about how South Carolina has been at the forefront of this push to break the stigma and how they're helping athletes every day.
I've been here for almost 20 plus years. We had at that time 2 additional psychologists that worked with me, and we were trailblazers. I mean, I think we were the first to have mental health services provided for an athletic population.
Dr. Timothy Malone and his team helped lay the groundwork for providing mental health care to South Carolina's teams. He credits university officials with having the foresight to see its place in college athletics.
I think the reason we were kind of on the cutting edge is because we had leadership at that time who saw the need, first and foremost, for mental health care. And certainly it has evolved, and the whole world now understands how important this is.
That continued when the NCAA helped set a standard across athletics.
Really since about 2015, 2016, they've developed, a really all-inclusive kind of approach to bring mental health up to what we do for physical illness with our student athletes. Kind of recognizing that athletes are not, supermen, superwomen. They still struggle with the same kind of mental health concerns that others do.
The Mental Health Division of Sports Science at South Carolina offers a wide net of support.
We see all of our student athletes. We serve all of the Olympic and revenue sports. We can see people for anything. It could be, depression, anxiety, but it could also be something, communication problems, relationship issues. It doesn't have to be necessarily a mental illness that will bring somebody in.
They can arrange appointments with us. We have several points of contact that they can do that either via their phone or call our office, and they can set up to see either me or one of our other ancillary or mental health professionals, regardless of the issues that they're struggling with. Sometimes we'll even see teams based on, a group, issue that they're dealing with, or coaches. So you name it, we're here for them regardless of their situations.
Athletes today face new challenges, though.
Things like social media influence in one's life definitely has been researched to show increased anxiety, depression. That's been proven. When I first started 20 years ago, there's very little commentary, individual commentary about student athletes. Today, a kid can pick up the phone and find out the good and the bad and the ugly about, their performances, and that creates a lot of anxieties that sometimes send kids to our doors as well. And we do have a number of high-profile and international students, and it does create for that individual a greater or heightened sense of anxiety for performance. And we see a number of those kids that struggle with the big stage, trying to collect their emotions so that they can perform well at this level.
It's not just social media that impacts our student athletes now. It's the NIL, it's sports betting and people having access to them through social media. There's a lot of different things that really impact our student athletes that didn't exist 15 years ago.
I mean, you're taking an 18, 19-year-old kid and putting, in some cases, millions of dollars in their pocket. You sure hope they have good family support, good emotional support to help them manage those kinds of funds. So yeah, NIL has definitely, been a plus for our sporting programs, but it's also had that bit of a downfall in terms of, I'd recommend to a lot of kids, get yourself a good accountant. Pay your taxes. make sure that you're managing these funds well, because in some cases that may not be there forever.
And as Sarah Knoll and Dr. Malone shared, their methods and resources have had to change with the times too.
You have to try to find out, why the kid plays the game. Some kids don't really enjoy playing the game. They play it, maybe for financial gain, to pay for college, etc. So you got to meet them where they are and help them determine a goal list for themselves. What does this mean to you? What does this money mean to you? And put things in perspective so that they can manage their anxieties, fears, expectations, families' expectations of this college sport.
Specific skills that we're teaching these kids, it could be anything from problem-solving skills, time management skills, communication skills on how to talk to people about their experiences, sometimes boundary setting, just learning how to say no can be really impactful for them too. So it really is tailored to whatever that student athlete needs at the time. We also go out and we're in the cafeteria, we're at the practices, so people are able to see us and talk to us outside of the therapy room, and that can then kind of break down the barriers and help them see that we're just human too, and they can, come and talk to us about anything.
While their offices may be busier, they believe that's actually a sign of something positive happening.
I do think that we have more kids coming forward because the stigma is breaking. People do feel comfortable increasingly to come and talk about their emotions, and a lot of that has come from well-informed but well-intended athletes, well-known athletes that have spoken out about their own struggles. And it's kind of made it, safe for, student athletes to do just the same.
The more people who talk about it, the less stigmatizing it is, and the less people are afraid to even mention emotions. I think if we start thinking about mental health the same as physical health, you can be really healthy physically and you can be really healthy mentally, but you still have to do things to take care of yourself, and you still have to do things to take care of your mental health. It doesn't always lead to an illness, and we're there for the whole spectrum.